Okay. Right. So, good afternoon, everyone. Thank you for your time in joining us in today's health talk on oral hygiene and dental care for seniors. So, my name is Fadila, and together with me will be my colleague Amira. And question and answer session will be at the end of the presentation lah. So, you may actually use the chat box as well to post your questions. Right. So, here's our portfolios. Okay, so for today's health talk, we are going to go through on overview of oral health. What are some common oral diseases that elderly tend to suffer with? Complications of gum disease, treatment of gum disease, the importance of oral hygiene, steps for maintaining oral hygiene and dental care. All right, so WHO in 2023 stated that oral health is a state of the mouth, teeth, and orofacial structures that enables individuals to perform essential functions such as eating, breathing, and speaking, and encompasses psychosocial dimensions such as self-confidence, well-being, and the ability to socialize and work without pain, discomfort, and embarrassment. Oral health varies over the life course from early life to old age. Is integral to general health and supports individuals in participating in society and achieving their potential goals. So oral diseases are among the most common non-communicable diseases worldwide, affecting an estimated 3.5 billion people. So while the global burden of oral health conditions is growing, particularly in low and middle income countries, the overall burden of oral health conditions on services is likely to keep increasing because of population growth and also aging. So oral diseases disproportionately affect the most vulnerable and disadvantaged populations. So people of low socioeconomic status carry a higher burden of oral diseases, and this association remains across the life course from early childhood to older age, and regardless of the country's overall income level. So here's what you need to know about age-related dental issues. So the animal that protects our teeth is the toughest tissue in the body, but yes, chewing, gnawing, and also grinding can take its toll. So according to Dr. Yao, a dentist from Ng Teng Fong Hospital, states that time naturally exposes the teeth to more wear and tear, chemical and bacterial attacks. So older adults also tend to have gum recession, exposing the roots of the teeth, which do not have the protective enamel layer and are thus more prone to caries, known as cavities, caused by the bacteria. She also added that older adults are also more likely to have illnesses, limited hand dexterity, or low vision that may limit the adequately daily oral hygiene as well. Medications such as antihypertensive, diuretics, antihistamine, and opioids too may result in a dry mouth and increasing the risk of having cavities. She also pointed out that elders with decreased mobility may also not visit their dentist as routinely as before, as they may delay the chances of preventing and treating dental caries and periodontal diseases. So an added challenge for seniors who wear dentures is that dentures add to the higher incidence of food accumulation in the mouth and physical friction to the soft tissue and gum if it's not properly kept. So here are the common oral conditions. Firstly is the periodontal, or known as gum diseases. It's actually due to the accumulation of bacteria in your dental plaque, result in the inflammation and infection of the supporting gums and bones. For root caries, or known as cavities, are formed by bacterial acid attack on the root surfaces of the teeth. So the build-up of the dental plaque is a sticky film made up of salivary proteins, food debris, and bacteria. When left on the teeth for prolonged periods, the bacteria actually multiply and excretes acids that attacks on the tooth structure, supporting the gum and ligaments. So the sugars actually from the debris of the food actually can feed this bacteria and increases the risk of erosion.
The rule of thumb is don't be too overconfident also.
So tooth wear or the loss of tooth structure due to friction such as chewing, grinding, or from the excessive brushing or picking, or chemical erosion from acidic diets or gastric reflux. Tooth loss is usually due to decay, gum problems or physical injury or trauma. For dry mouth, caused by disorders of the salivary glands, a side effect of medication or from radiation treatment to the head and neck for those who are having cancer. Stomatitis or the inflammation and infection of the soft tissues in the mouth caused by the friction from dentures, irritation from spicy or acidic food, allergic reaction to filling materials or microbial infections. For those who have oral cancer or the growth of invasive tissues actually destroy the normal oral structures, and this causes is usually unknown, and although the risk factors include smoking, drinking, and bitter nut chewing. Okay, so here are the stages of the gum disease. As you can see from the first stage, it's actually a healthy gums and tooth. As you can see, the gums are pinkish in color. Okay, then the next stage will be the gingivitis. Okay, yeah, so it is the earliest stage of gum disease, and it happens when plaque and bacteria build up on the teeth and cause infection. So the common symptoms including red, swollen, bleeding gums, and treatments include regular dental cleanings and improved oral hygiene at home between dental visits. So at this early stage, this gum disease, which is the gingivitis, damage can be actually reversed. For the third stage is the periodontitis. So at this stage, the supporting bone and fibers that hold your teeth in place are irreversible damage. So your gums may begin to form a pocket below the gum line, which traps your food and also your plaque. So proper dental treatment and improved home care can actually help to prevent from further damage done. So the last stage will be the advanced periodontitis. So at this final stage, the fibers and bones and supporting your teeth are actually destroyed, which can cause your teeth to shift or loosen. Okay, and this can affect your bite. And if aggressive treatment such as giving antibiotics cannot save them, so your teeth need to be removed. Okay, so other signs and symptoms that you need to take note firstly is the shaky teeth or teeth appearing to drift apart from its original position, or receding gum line, which is gum recession. You have chronic or persistent bad breath or vague discomfort of dull ache in gums and teeth. So it is time for you to visit the dentist. So here are the risk factors of gum disease. Firstly, if research shows that there is an increased prevalence of gum disease among diabetics, so for those poorly controlled diabetes. So imaging research also suggests that the relationship between the serious gum disease and diabetes is a two-way. So not only are people with diabetes are more susceptible to serious gum disease, but it may have the potential to affect blood glucose control and contribute to the progression of diabetes. So if your blood glucose levels are poorly controlled, you will likely to develop the serious gum disease and lose more teeth than the non-diabetics. So like an all infection, serious gum disease may be a factor in causing blood sugar to rise and may make your diabetes harder to control. So other oral problems associated with diabetes include thrush and also infection caused by the fungus that grows inside your mouth, and dry mouth, which can also causes soreness, ulcers, infections, and cavities. So you can help to minimize your dental and oral problems with good diabetic control and let your dentist know that you have diabetes. Secondly, heart disease. So research also indicates that chronic gum disease may also contribute to development of heart disease. So it is thought that the bacteria in the gum disease actually enter the bloodstream and attach to the fatty deposits in the heart blood vessels. So this condition can cause your blood to clot and may lead to heart attacks. So let your dentist know also if you have heart condition or taking any medication, so he or she can actually coordinate any treatment with your doctor. Thirdly, you'll be heavy smoker. So using tobacco or e-cigarettes like vaping hurts your whole body and including your mouth. So it's one of the biggest risk factors of gum disease. So the telltale signs of tobacco use include receding gums, chronic bad breath, and stain of your loose teeth. But more serious problems such as oral cancer, it can be harder to spot, and vaping is no better than using tobacco. So people who smoke are more likely to produce bacterial plaque, which leads to gum diseases. And the gums are affected because smoking causes a lack of oxygen in your bloodstream, and therefore the infected gums do not heal well. Okay, and dental plaque that is left on teeth and gums can harden to form calculus, and this calculus is stiffer and more tightly attached to the teeth than that of the non-smokers. So smoking also increases the growth of Candida albicans, which may promote the adherence of plaque to the tooth surface and accumulation of calculus, and thus periodontal disease and gum recession. Next will be the hormone changes. So the hormone fluctuation or changes can occur during puberty, menstruation, pregnancy, and menopause. They may affect the gums and increases the woman's risk of periodontal disease. So any pre-existing periodontal disease can become more severe on top of that. So a lower immunity against infection. So when your body defense system is very weakened, so it's more susceptible to germs, and your mouth contains a huge number of germs that can actually cause serious infection. So for poor nutrition, it actually increases the chances of developing periodontal disease because inadequate nutrition actually weakens your immune system itself. So, and diet high in sugar and also processed carbohydrates as well can increase the inflammation and susceptible to periodontal disease. So here's the complication of gum disease. Firstly is the tooth loss. So without regular dental checkups, gum disease can affect your gums, jawbone, and the tissues that connect your teeth to your gums. So the receding gums, gum pockets, and bone deterioration can actually occur. So your gums eventually become unable to secure your teeth in place, and tooth loss results. So tooth loss can affect more than the way you eat and speak. So when your teeth are in place, they work to stimulate your jawbone, which triggers the release of fortifying nutrients that keep it strong enough to support your teeth. So when you lose your tooth, your jawbone loses a source of stimulation at the site of the loss of tooth. So the change can initiate your bone loss in your jaw because your body loses a source of stimulation tied to the release of nutrients that supports your bone regeneration. This change can actually weaken your jawbone and allow existing healthy teeth to shift out of place. And a damaged jawbone can affect your appearance as well because it changes your facial structure. Next will be swollen or red gums. Okay, so swollen or red or tender gums can occur during gingivitis, the earlier stage of gum disease, when plaque accumulates along your gum line. So this can occur as a result of inflammation and your body's natural response to the bacteria. So affected gums typically appear red and may protrude out of the hard parts of your tooth. And if you have gum disease, swollen, red, or tender gums may form around one tooth or your entire mouth. Next will be the chronic bad breath. So bad breath occurs often with gum disease. So the odor originates from the gases that is released by the bacteria caught on and in between your teeth. So tiny pieces of food debris can actually get caught with the bacteria and release odors as they begin to deteriorate. So food with naturally strong odors like onions, garlic, and spices can actually intensify the smell as well. So if you have diabetes, you are more likely to have gum disease as well, as I explained earlier. So the combination can be dangerous because bacteria from your infected gums can leak into your bloodstream. So this activates your body defense mechanism, which result the higher blood sugar levels and the potential for developing complications associated with this condition. So people with gum disease also have higher rates of cardiovascular disease, resulting in more heart attacks and strokes. So this may occur because the bacteria from the gum disease can enter your bloodstream and causes atherosclerosis, a condition which plaque builds up in your arteries and hardens. So when this condition makes you more susceptible to actually having blood clots, which can cause you to have heart attack or stroke when blood flow is restricted. You may have a higher risk of developing some types of cancer if you have gum disease. So a long-term health study reported that participants with advanced gum disease had a 24% higher risk of cancer versus those with healthier gums. So study participants with severe periodontal disease had more than double the risk of developing lung cancer compared to those with a milder form of the condition. And gum disease also affect your respiratory also lah. And actually increase your risk of developing respiratory infection like bronchitis or pneumonia when the bacteria in your mouth actually passes from your upper throat into your respiratory tract. So when this gum disease can also worsening your existing respiratory condition, like if you have COPD or asthma lah, because it actually increases the inflammation in the airways. So here's the treatment for gum disease. So what you need to know that the type of treatment and number of visits will vary depending on the extent of the disease. So if you have healthy gum, healthy teeth, so it's a must for you to actually follow up with the dentist every 6 months. Okay, so it depends on the doctor. So once the dentist actually assess your gums and your teeth, and if they think that they need to if there's some issues or problems, they will want you to visit them more regularly lah. Okay, so it is important to maintain good oral hygiene, and also smokers are strongly advised to quit smoking to improve the treatment outcome. Okay, yeah. So next so for preventing of gum disease, as you know, plaque actually forms within hours, and effective removal of plaque can actually help to prevent gum disease lah. So what you need to do, you need to brush your teeth at least twice a day. Brush half an hour after meal. Okay. Use interdental brush on teeth with a larger gap, and also you need to visit dentist routinely, for every 6 months for maintenance if your teeth are healthy. Okay, and do not use tobacco products. Right? Yeah. So next, I will pass to Amira.
Okay, so now I'm going to talk more on why is good oral.
Sorry, yeah.
So sorry for the interruption. Okay, so I'm going to continue from here. So why is good oral hygiene is very important? So as what I mentioned just now on the previous slide, so oral hygiene includes all the processes for keeping mouth clean and healthy. So for good oral hygiene is very necessary for prevention of dental caries, periodontal diseases, bad breath, and other dental problems that actually Fadila have already mentioned. Okay. So the importance of good oral hygiene. So firstly, prevention is always better than cure, and good oral hygiene habit will keep away most of the dental problems, saving you from toothache, and most importantly is the costly dental treatments. Okay, because as you can see, dental treatments can be very expensive. So awareness regarding the importance of oral hygiene has significantly increased in the developed countries, but contrary to that, the modern dietary lifestyle habits are posing a greater risk for oral health. Okay, so good oral health is very important to your overall well-being. So these are the basic steps for maintaining oral hygiene. So firstly is to brush your teeth and use of the interdental aid. Secondly is to regular visit to the dentist. And third is to avoid high sugar diet. Why is high sugar diet we need to be avoided? Is because when sugar are consumed, it interact with the bacteria within the blood to produce acid. And this acid is very responsible for tooth decay because it slowly dissolves the enamel, creating holes or cavity in the teeth. So tooth decay can lead to tooth abscesses, which may result in the tooth having to be removed. Okay, so this is the basic step for maintaining oral hygiene from Oral Health Movement Campaign 8020. So I'm going to show you some example on how to brush your teeth properly. So first, for good oral health, so brush your teeth. So always remember to brush your teeth twice daily to keep your teeth and mouth clean, and this will help to prevent tooth decay, gum disease, and bad breath. So first is the teeth brushing techniques, which I will show you later on. So first is to angulate toothbrush along the gum line at a 45-degree angle. Okay, so here with me is an example. So you have to face your toothbrush at a 45-degree angle over here. Okay, so firstly is to gently brush outer tooth surface using a vibrating back and forth motion along the gum line. So what you need to do is that 45-degree, and then you have to back and forth gum line. Okay, followed by a rolling motion away from the gum line. So just cover about 2 or 3 teeth at once. Okay, so you go on. Okay, I will show you. Okay, so you just 1, 2, 3, 4, 5. and then you go on 1, 2, 3, 4, 5. Okay, so for this from over here, so from here you can, if you cannot do it's very hard for you to do this angle, you can use in this angle over here, like straight like that. Okay, so for the inner, so you just do the same also. Okay, I don't know if you can see. Okay, inner, you just do the same also. Just do a rotating motions like this for all the teeth. Okay, so for the biting surfaces, you just have to do a scrubbing action front and back like that. Same from the top also, you just do a front and back. Okay. Okay, so for use of interdental aid, so for use of interdental aid, you can use a floss string, so in between the teeth, okay, or you can also use this can be one of it. If you can see, this can be one of it. You can use it in between your teeth area, okay. For example, in this way, you can use your teeth, such as like when you do a floss string also, okay. So for missing teeth or spaces, you can use the single tufted or end tufted brush. I do not have it with me right now, but you can actually find it in the market or anywhere. But just say about this single tufted and end tufted brush. Okay. Okay. So for the third, the importance of cleaning your mouth even you do not have any teeth. So it's very important actually for you to brush your teeth twice daily to keep your teeth and mouth clean, even if you do not have any teeth, because you should clean your gums and tongue with a soft toothbrush to maintain good oral hygiene. So for people who have denture, there's also a step for you on how to actually clean it. So first is to place denture over a basin or tray of water when cleaning, and this will help to prevent breakage of denture. So secondly is to use mild dishwashing liquid and a hard toothbrush. Avoid using toothpaste, okay, because it can become too abrasive. So last is clean all surfaces of the denture. Okay, and then the fifth is to remove your denture, especially before you go to sleep. Okay. Okay, so these are the exercise that you actually can do. Okay, so actually we can do it together, okay? So for first one is the muscle around the mouth. So these exercises will help to strengthen the muscles around your mouth. So actually this one exercise you need to do 5 times per set twice daily. So first one, I'm going to show you how you can actually do it. So you move your muscle around your mouth by saying ooh and ee. Okay, so first round your mouth as much as possible and say ooh. And then B is to stretch your corner of your mouth as much as you can and say E. Okay, everyone can do together. Okay, we do together. Okay, so 1, 2, and 3. Ooh, E, ooh, E, ooh, E, ooh, E, ooh, E. Okay, this will help to strengthen the muscles. So remember to do twice daily. So for the second one is to actually puff your cheeks and move your cheek muscles. So first is to puff your right cheek like this. Okay, so second one is to puff your left cheek. Okay, and then last is to puff both of your cheek. So you need to do 5 times also. So like this. Mm, 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 Okay, so that's the exercise that you can do at home. It's very easy and it's very fast. Okay, so for the next one is the chewing ability. So cut your food into smaller pieces and chew your food thoroughly before swallowing. This is very important because this can reduce the risk of choking. So these exercises will help to improve on your chewing ability. So this is also the same twice daily. So first is to practice opening your mouth. So open your mouth wide and hold for 10 seconds like ah. And then you close your mouth to rest for 10 seconds. Okay. So we won't do this exercise, but you will do when you start chewing on your food. Okay. So you need to do this for 5 times continuously. So next is to chew your food on both sides. So first is to chew your food at least 15 times on each side of your mouth. So right time 15 times, and then you chew 15 times on your left side, and then you swallow your food. Okay, that's very important for your chewing ability. So for the next one is your swallowing ability. This exercise will help to strengthen your swallowing muscles and then reduce the risk of choking while eating. So each exercise you have to do about 5 times per set and twice daily. So the first one is to actually massage your salivary gland to stimulate the saliva glow. So the first is to use 2 fingers, okay, stroke from in front of your ear. So if you cannot see because you cannot see my ear, right? You can see my colleague on the screen. You can use 2 fingers stroke from in front of your ear to your cheek 5 times. 1, 2, 3, 4, and 5. Okay. So the next one is to stroke below your jawline. Okay. From below your ear, okay, your ear to the center of your chin. Okay, 1, 2, 3, 4, and 5. All right. So the next exercise is to push your tongue against the roof and the roof of your mouth and swallow hard. So what it mean by that is that push your tongue against the roof like this. Like my friend over here, Fadila, you can see, and then you can swallow hard, and then you can do it 5 times. Okay, and then lastly is a tongue hold exercise. This exercise is to strengthen your swallowing muscles. So what you need to do is to stick your tongue out beyond your lips like this, and then keep your mouth closed and swallow your saliva, and then do it 5 times per set, twice daily. Okay. Okay. Okay, next is the denture care, which I already mentioned, but so I'm going to emphasize again. So denture care is basically you do not accidentally drop them. Secondly is to do not use toothpaste. Thirdly is to brush and rinse every day. So it's very important for you to also use a denture cleaner, because some people tend to use a tablet to actually clean to put in a cup, and this can help to kill the bacteria. So lastly is to keep denture moist when not in use. So how to clean a denture is that you clean with a denture brush or soft toothbrush and water at least twice a day. So you can also soak a denture in clean water when not in use. Once a week, you can actually soak in denture cleansing agent to remove the stain and rinse off the cleansing agent before wearing it. And it's very important also for you in daily basis to actually keep your denture in a clean denture storage container, completely soaked in the water. So this is how you brush your denture. You need to brush on your outer surfaces, inner surfaces, and the chewing surfaces, just like how I just now teach you on how to brush your teeth. So many people sometimes will tend to ask, like, why must we see our dentist? Our teeth are still strong. Sometimes you may say that in our days we don't need to see dentists, but yet our teeth are fine. So it's very important to really see the dentist, because like what emphasized by Fadila just now, I'll go through about all the gum disease and the tooth loss. So it's very important for you to see the dentist regularly. Okay, to emphasize also, you have to visit the dentist at least twice a year, every 6 months, or as recommended by your dentist. Okay, so these are true or false question. Any of you can answer, okay? So the first statement is only children can get cavities. Anybody can answer true or false?
False.
Okay, yes, correct. So it's a false, because tooth decay can actually develop at any age. It can happen as long as you have a natural tooth. Okay, so it's very important for you to really follow the recommendation for the oral health. Okay, next. Okay, second statement is that gum disease is just a part of growing older. True or false?
False.
Okay, good. So it's a false. You can prevent gum disease, and it does not have to be part of getting older. Okay? And then next. Okay, thank you. That's our health talk for today. Any question?
为什么这样少？
Thank you for the talk.
Welcome. Any questions so far?
It's quite clear. Thank you.
Okay, that's good. So you can practice your proper brushing techniques also as well at home. Okay. So if you not so sure about the proper how to, maybe if you forgot the steps, you can actually go to the YouTube and you can type proper brushing techniques by the National Dental Center. So you can see and step by step on how you need to brush your teeth. All right.
Thank you for joining.
Can you please repeat YouTube? What? Where
Okay.
must we go?
Okay, you can go to the YouTube. Then you will type proper brushing techniques under National Dental Center. So they will tell you step by step on how to brush your teeth, and also if you use those the what I call it, if you don't have this brush, or you use the battery operated toothbrush, they also will tell you how to use it. Yeah.
Hi, may I ask the question, please?
Yeah, sure.
For denture, after we use it for some time, we need to go back to the dentist, ask them to grind it, right?
Yeah, sometimes when sometimes your face will shrink, right? Either will shrink or you put on weight, then the facial structure will be different. So it's best to follow up with a dentist. Sometimes it becomes too loose or becomes too tight. So the dentist need to actually remold again and to give you a new set of dentures.
Okay, thank you.
No problem.
Okay. So thank you for joining. Do join the Mandarin Health Talk next Monday. Thank you.
What time is it for next Monday?
It will be 2 to 3 p.m. as well.
Okay, thank you so much.
No
Goodbye.
Thank you so much for the talk.
Thank
Bye-bye.
you. Bye-bye.
Thank you.
Well done. Thank you.
Good.